Hi, guys. Today I thought I'd talk to you a little bit about dementia, what it is, and then offer you some tips and techniques on how you can handle a client that may have a diagnosis of dementia. So, dementia is actually a brain loss disease. Dementia is kind of like the umbrella effect. We call it a syndrome. And then underneath that umbrella or syndrome, we have all of the symptoms that make up dementia. Now, by symptom, I mean the brain disorders such as Alzheimer's disease, Lewy body disease, frontal temporal disease. So these are what we call the symptoms that make up the characteristics of dementia. Alzheimer's disease is number one. It makes up 64% of dementia. So dementia basically means you're going to notice changes in your client's cognitive functioning, the way they think, the way they reason, the way they remember things, and the way they make decisions. You'll start to notice a gradual change or decline in your client's ability to do those types of things. So, how can you help them through this decline? Well, number one, I think, is going to be to know your residents. Every resident is going to have an individual behavior change. So, the more you can know about your client's behavior changes, the better you're going to be able to handle them. And sometimes these changes, they could be harmless. Other times you might see your client getting irritated, more aggressive, combativeness, that type of thing. So, two things you should try to figure out. What are your client's triggers? A trigger is a word we use to what brought on their behavior, what brought on the change of behavior. If you can figure that out, you're better able to prevent that in the future. Maybe it's another resident talking to them. Maybe it was something like a fire alarm that started to get them more irritated. If you can figure out what their trigger is, you can prevent that in the future. And then the opposite of that would be, do you know any words or anything that will help calm your client down or actually change their focus? So if you can find out some important things about their life, maybe it's a family member, maybe it's a street they lived on. I personally used to use small towns. If your client's from a small town, you can start talking about that town. It kind of changes their focus right away, and they might start actually talking to you about the town that they grew up in. That's a good one. And even if you kind of change your physical stance or your physical words, because sometimes I used to start whispering. And when you start whispering to a client, they kind of stop what they're doing because they're trying to hear what you're saying, right? So little things like that to change their focus can actually get them away from a negative behavior. And then that gives you an opening to kind of talk to them, keep them calm, and then move on with whatever tasks you wanted them to do at that time, right? So I think those things are very important. Also, the approach the caregiver does for the client is also important. You should be approaching them in a calm manner. You should make sure you're outside of their circle of comfort, which is usually a 3-foot circle around your client. And how you stand is going to affect your client. Everything the PSW does, everything the PSW says will affect their client. There's kind of an interaction going on there with the client looks at you. If you look angry and miserable, your client's going to be angry and miserable. Okay, so you present yourself in a positive manner and you stand calmly outside of your client's 3-foot circumference of comfort, and much better, much more effective care, or you could say a better chance of providing effective care if you kind of follow those types of techniques. Okay, so hope some of those work for you, and remember to like, share, subscribe. I'll see you next time on JoJo the Caregiver Show.